In this video, we're going to be looking at shoulder range of movement and testing this. The shoulder has quite a lot of large movements that it is able to do as it's a mobile joint. In this particular video, we're going to be looking at four in general movements. We're going to look at our flexion range of movement, our abduction range of movement, and we're looking at the internal and external range of movements. The reason I have picked these four movements are these I generally find when I'm in clinic are the movements that people tend to complain with the most, noticing that they've lost range of movement or are causing pain and discomfort. So to begin with, I'm going to look at the flexion and abduction. So generally with this testing, we're looking at whether muscles relating to the pecs across the chest and the lats across the back. So if these will give us indications of movements of how we're holding our body, but it also can give us information around if there's any issues relating to sort of shoulder impingement and things like this. So to begin with, you want to make sure you're sat flat up against a wall. So you've got the back nice and flat against that wall, and then we're having the arms shoulder width apart. And then from here, all we're going to do is bring those arms up overhead as far as you comfortably can, keeping that back flat to the wall and the arms straight. So for me, I'm not that far from the wall. I'm about here. If I want to get further without cheating, I need to bring my arms slightly wider. And that's the key detail to help know what's going on. So as I'm going through this flexion and want to drop out in order to get that last end range, it just tells me that there's some tension sitting through that lat muscle. Secondly, we're going to look at the abduction muscle. I'm going to stand up for this so that there's a bit more range movement space even. And then from here we want to be stood flat against the wall, just like we were with the back flat, keeping it against. And then we're taking those arms up overhead like so. And we're looking at how far overhead you can get, keeping the arms straight and the back flat against the wall. I can get a little further in this direction than I did before, so that tells me that my lats are tighter than my pecs. But if you're noticing that you're wanting to bring forward, or there's any bending, or there's the arching happening in this range, it will tell you that there's tension sitting in that pec muscle. The other ranges I wanted to look at in this video is the rotational muscle movements. These relate to most common muscle group that are talked about in the shoulder as the rotator cuff, which is really important with shoulder control as it's so mobile. So it's useful to see what these are up to. So the first one we're going to look at is the internal rotation. So you're scratching your back, reaching round as far as you comfortably can with one arm. And you're noticing to see where this hand reaches on your back, like so. And then we're doing the same, but on the opposite side. And you're looking to see if there's a difference between left and right, any sensations that you're feeling. And you'll also potentially use useful information when we look at this test in clinic is to actually take a note of where your shoulder blades are in relation to it. So are you noticing that they're coming away from your back, or do they stay flat against your ribs? All of this will help give you information as to what that movement is like. The lower down the arm is, the more discomfort around the front of the shoulder or the winging that could be occurring will give you clues as to whether that range of movement is tight. The next movement is that external rotation. So with this one, we're reaching up and bringing the arm overhead and down the back, as if you want to scratch your back this way. And again, you're looking to see if you're able to lift the arm up, how far or comfortably it can reach round into this rotation, if there's any differences between the two sides, if you're limited, if you're not able to bring the arm in close, or if you're having to reach across. Again, these will give you information as to whether that range of movement is tight or not. And if there's anything you found in this video when you've been checking and following along, if you have any questions, you can always drop us a message.